So if your priorities are constantly on roads and airports and smart trains, which are all good, I'm not saying no, but then you don't pay attention to health and education. So it's something like, would you eat ice cream or do you want to eat rice first? What comes first? See, I have actually come across individuals who have died for a 10 rupee intervention, not being able to afford. So and even today we have about 8 lakh children dying of diarrhea. What does diarrhea? How do you die of diarrhea, you tell me? It's either contaminated water, which is a right. 75 years you're not able to give citizens clean, uncontaminated water to drink.
Yeah.
And this is a basic, isn't it? What have you achieved? Yes, a soundbite, very impressive. But we have journalism which is not investigative. But what is inside that medical college? No faculty, no students, no laboratories, no nothing. Opening colleges means nothing at all. Where is your faculty? Then you have to have at least 4 or 5 years training. The 6 aims that were envisioned by Sushma Swaraj in 2002. The building started in 2009 and 10. Look at the time lag it takes. The vascular diseases are the ones which are killing most of our people. And that itself is a very huge burden. Mental health is one area where there's not only a very huge disease burden, it's expensive to treat and it's chronic. 1.5% people have mental illnesses. We did relatively reasonably well in managing COVID, but are we really prepared to see that so many people don't die or get infected? I don't think so. Virus is going to hit us again. And we have to be mentally prepared to say that COVID last word has not been said. Definitely we should be prepared.
She has overseen COVID. She has seen many other things. She has been in charge of NACO, National AIDS Control Organization. She has been overseeing the vaccination drives. So we are with Ms. K. Sujatha Rao. So a very warm welcome to you, Ms. Rao, again. I had just a couple of questions about whether health for all is a chimera or is a possibility.
That's what we battle discussing about it. Idea-wise, it is possible and it should be done.
Yeah.
But it's very difficult unless and until under 2 conditions are met. One is a very, very strong political commitment to that. And the second is that along with that political commitment, resources have to be allocated. We are still spending about 1.2% or 1.3% of GDP on health. It used to be 0.9 40 years ago. So we've just moved the needle by another maximum 0.4, 0.5%. This is not it. We have to spend a lot more on health.
Approximate how much?
Public spending must at least be 3% of GDP. Must easily.
But over the years, the size of the GDP is also
has gone. But you don't
the
have
population
priorities.
is also
You don't prioritize health. No,
Hmm.
it's a question of prioritization. If you can give loan waivers, if you can give write-offs to the very rich, if you can go on constructing roads after roads are important. But
health is also important.
I mean, having now, for example, Dehradun to Delhi, why do you need so many roads? Now another 2.5 hours you will reach. Why? Who is in such a great hurry that, instead of 3 hours, then you must reach, say, 2.5 hours. They can reach in 3 hours, no problem. So if your priorities are constantly on roads and airports and smart trains, which are all good, I'm not saying no, but then you don't pay attention to health and education. So it's something like, would you eat ice cream or do you want to eat rice first? What comes first?
Yeah.
So, you have the money, how are you spending it on whom? So that is a political decision, and that only politicians can prioritize that.
You have such long experience in the health sector. What do you think is more important, setting up a medical college in every district or strengthening the primary health sector, say CHCs or PHCs?
See, I have actually come across people, individuals who have died for a 10 rupee intervention, not being able to afford. So, and even today we have about 8 lakh children dying of diarrhea. What is diarrhea? How do you die of diarrhea, you tell me? It's either contaminated water, which is a right. 75 years, you're not able to give citizens clean, uncontaminated water to drink.
Yeah.
And this is a basic, isn't it?
Yeah.
So when you are still not able to give access to basic goods like basic healthcare, and we after 75 years are still in that position, then I think we have to first attend to the foundation of a health system before thinking of medical colleges. Now, having said that, medical colleges have their own role to play because you need more and more doctors, keeping in tandem with the population growth. But that doesn't mean that you keep on opening colleges. There's no faculty. Today you have 750 or 730 medical colleges. 50% of them can be shut down today. They're only on paper. What have we achieved? Yes, a soundbite, very impressive. But we have journalism which is not investigative. Right? Nobody investigates. Oh, wonderful, 730 medical colleges. But what is inside that medical college? No faculty, no students, no laboratories, no nothing. So you have these students who come, they're passed because they dare not, the college will show up. We don't have a proper testing.
So that means the regulatory
system
body, like
very weak.
medical
And we have more quacks than doctors coming out. And you're playing with the life of another person. So
actually, there was a shortage of medical professionals, because of which
we do have a shortage. So that's why it's said medical colleges, though basic healthcare is important, medical colleges are equally important because you need doctors. You need many more doctors.
But you need good doctors.
But you need quality. You just cannot churn them like some in a machine.
Right.
Going on opening colleges means nothing at all. Where is your faculty? Then you have to have at least 4 or 5 years training. Even today, the aims that we have set up, the 6 aims that were envisioned by Sushma Swaraj in 2002, the building started in 2009 and 10. Look at the time lag it takes.
Bhopal, Jodhpur.
Yes, Bhopal, Jodhpur,
Rishikesh.
Patna, Rishikesh, and there were 6 of them. Chhattisgarh, Raipur, and so on.
But they're still very nascent stage.
They are almost over 75% faculty full, but there's still so many little problems.
Because nobody wants to leave a metro like Bombay and Delhi to go
to Rishikesh or something. So so what I'm trying to say, building an institution takes a lot of effort. Today, Delhi aims because how much of investment and support has gone into it. So it takes time. Now, instead of focusing on 6, maybe you expand it to another 12 more. You have 23, 25 aims. Anyone wants an aim, you will sanction it. What does it mean? Where's the faculty?
Yeah, one more thing. Now, since the government has started this health scheme,
Ayushman
Bharat Yojana. So, how do you rate this?
That's an excellent scheme. And it has, as you know, two-pronged scheme. One is it is trying to address the issue of financial risk protection by giving insurance. Now, this year, Prime Minister has said all the 70 plus will be covered, which is really an excellent initiative for the elderly. So, Ayushman Bharat is one. But the offside of this insurance program is that it is a demand side. Means you have the power to buy healthcare for 5 lakhs. But वो healthcare provide करने के लिए तो कोई होना है ना. So आप जाइए कहीं वैशाली या वहाँ पे क्या hospitals हैं आपके वहाँ. So you're from UP. Half of UP has nothing. So what do you do with this 5 lakh rupee check when there's
people
no doctor
from UP
there?
are either coming to SGPGI
So they have to go to other places. So that portability, as it's called, is allowed. But then at the same time, there's so much of local demand itself. Secondly, how many people can afford to go to Chennai or where the hospitals are all in the southern or Maharashtra or Calcutta. You'll go for the surgery, but then post-surgery, you can't keep sitting there. It's expensive
Right.
to go and sit. You might have treatment in
Yeah,
Tata
the
Memorial.
treatment might be
Where do
free,
you
but
stay?
Yeah,
Where do you stay? So, therefore, you have to, along with insurance, also create the supply demand has to be in balance. The second component was strengthening primary healthcare, which I fully agree, and it's a very important initiative.
Mhm. Then there are there were traditional uh, ailments like diabetes, hypertension, lifestyle diseases, heart related, liver, kidney. But now two things are overpowering other illnesses. One is mental illness and the other is cancer. So how are we well equipped? How well are we equipped to deal with these things?
Well, among the non-communicable diseases that you've said, the killer is heart. The vascular diseases are the ones which are killing most of our people. And that itself is a very huge burden. That said, mental health is one area where there's not only a very huge disease burden, it's expensive to treat and it's chronic. There's no prevention. You can't prevent getting mental health. You can prevent getting a cardiac arrest. You can prevent getting cancer.
And now almost more than
mental
6% of India's population.
6 to 6.5% people have mental illnesses. So you can't prevent it, but then it's also, you cannot cure it in that sense. It's a chronic ailment. So it requires a huge structural and financial intervention to address it. I really feel bad, but it's the most neglected sector in the whole health portfolio.
And what do you think about our preparedness for any eventuality like COVID? And how well did we fight COVID?
In COVID, I was not there. I mean, I had retired by then, but I very closely followed it up. I think we did relatively reasonably well in managing COVID because there were so many uncertainties. We didn't know how. If you remember, if you touch a table, you'll get COVID.
Yeah.
If we never knew what this whole COVID was. So many uncertainties and doubts. And wading through all that, something came out. But I'll tell you two things. One is that since from when COVID came to now, we are definitely better prepared because now we have the experience. If supposing something were to happen, we can in a much shorter time, quickly be able to get our act together. That confidence we have developed. But are we really prepared to see that so many people don't die or get infected? I don't think so. What do I mean? Because I think, the virus is going to hit us again. And we have to be mentally prepared to say that COVID last word has not been said. Definitely we should be prepared mentally and system-wise to say tomorrow a COVID outbreak can take place again. The virus is mutating every day. And every single day your population is going and interfering with the natural habitats. The environment-man conflict is increasing day by day, right? So you're bound to, once you interfere so much with nature, it's bound to have its own repercussions. So I don't think we've seen the last of such a pandemic. We should be prepared to expect another COVID-like pandemic.
Probably you talked about other countries like maybe Sri Lanka, which
no, any
Thailand.
Country, the world over, we are vulnerable. Humans are
but
vulnerable.
They were better prepared.
No, prepared in the sense, they were better prepared in the sense they have been giving a lot of importance to public health. Surveillance, they had good laboratory infrastructure, they had strong primary healthcare systems around. We did not invest like that earlier. So we were caught a bit unawares when COVID did hit us. But it's not that we don't have the capacity. I think India has tremendous capacity to handle these kind of public health emergencies. But the priority is not there. That's what I'm saying. The priority is not there to say that, tomorrow there's a nuclear blast. No, we are not prepared for it. For that, you have to have the discipline of people that, you have underground, you go there and then you hospital. I mean, there's so much of infrastructure preparation that you need. to face something like that. Same way for virus, you have to have surveillance units, you have to have information systems, you have to have strong data systems, you have to have strong community resilience. For that, you have to invest money and you have to keep the focus on it. हमारे देश में क्या होता है कि इमरजेंसी होता पूरी एवरी डिपार्टमेंट एवरीबडी वर्क्स ऑन इट, हल हो गया ना, सॉर्टेड आउट. फिर उसके बाद अदर थिंग्स, कोई इलेक्शंस आ गए, कुछ हो गया, फिर वो लड़की बहना और समथिंग एल्स जो भी है, व्हाटएवर द प्रायोरिटीज है उसमें चले जाते हैं.
एक लास्ट क्वेश्चन था मेरा कि जब भी जैसे आपने इलेक्शन का बात किया, तो व्हेनेवर द इलेक्शंस हैपन, द एंटायर मशीनरी, government machinery, especially the health workers,
everybody gets involved.
The education workers,
आंगनवाड़ी वर्कर्स, सब
सारे के सारे
इलेक्शन में जाते हैं, तो पूरा डिसरप्शन हो जाता है.
एटलीस्ट कुछ सेक्टर्स को स्पेयर करना चाहिए.
टीचर्स, स्कूल एजुकेशन का बंद हो जाती है, स्कूल बंद होते हैं. और टीचर्स हर दफा, I mean 60% of the teachers' time is going in data collection for the government. 60%, that's huge.
That's huge.
And I'm not joking. आप कहीं भी स्कूल टीचर से आप इंटरव्यू कीजिए, वो बताएंगे आपको.
So what kind of data collection?
30-40% नहीं, आज कोई सेंसस हो, फिर इलेक्शन रोल हो, या कुछ और ऐसे ही चलता रहता है. फिर कोई और there's no end to this kind of ये रिपोर्ट लाओ, वो रिपोर्ट लाओ. The kind of documentation, reporting, census work, इधर जाओ उधर जाओ, all this is almost 60%. तो पढ़ाते क्या हैं? गवर्नमेंट टीचर्स, और गरीब लोग जाते हैं गवर्नमेंट स्कूल्स. सो इट इज अ सीरियस मैटर एंड आई थिंक वी हैव टू डू समथिंग अबाउट इट. आई एम श्योर देयर मस्ट बी. बट अब सेंसस शुरू हो जाएगा, कास्ट सेंसस शुरू हो जाएगा, ये सब कौन करते हैं? टीचर्स ये तो करते हैं.
So I won't hold you back, but just last thing. We had launched universal immunization program long time back. But during COVID, everybody had to pay from own pocket for.
नहीं, ऐसा नहीं था. I mean, India can be very proud of its immunization record. हमने पोलियो इरेडिकेट किया, बहुत ही बढ़िया काम किया. तो वो एक्सपीरियंस था हमारे पास. इनिशियली 2-3-4 महीने के लिए थोड़ा खिचखिचा हुआ यहाँ पे सेंट्रल गवर्नमेंट में, क्योंकि दैट टाइम इकोनॉमी भी इफेक्ट हो गई थी कोविड की वजह से. सो पैसा भी कम था, तो उन्होंने कहा सबको पे करना चाहिए, क्योंकि ये तो हमने, इट्स नॉट एन आइसोलेटेड कि कोई 25 लाख लोग अफेक्टेड हैं, पूरी देश को करना है, पूरी पॉपुलेशन को सभी पे करें तो हल हो जाएगा. बट देन it was not sustainable, it was not affordable. People had also lost incomes. ये नहीं कि only government has lost, people have also lost. Where do you get 254 people 1,000 rupees for a vaccine which is not protecting you?
Yeah.
You have to take 2 vaccines. And वो भी क्या, it was only protecting you from going into hospital and maybe death. But you could still get COVID, and when you get COVID again, you're ill and you have to buy medicines, So in such an uncertain kind of a traumatic situation, to say you pay for a vaccine, which is a lifesaver, was a bit probably not politically correct. And then government realized and immediately withdrew and made it free. So everybody got free vaccine, but they said those of you who can afford to pay, want to go to a private hospital, please go. But that policy even today we have. If you go to Apollo and deliver, you will be getting access to all the vaccines there. And you pay for it. But then later it became, and I think government did a fantastic job in vaccinating the people. Great.
Thank you so much, ma'am,
great
for your